What are the differences between the Keto and Atkins diets? The Keto and Atkins diets both involve restricting carb intake, even in the final phase of the Atkins diet. However, there are key differences. Restriction. In general, the keto diet is much more restrictive than the Atkins diet. The keto diet places more emphasis on carb elimination, and it restricts protein sources, as the body may break down proteins into glucose for energy. The vast majority of calories in the keto diet come from fat. The Atkins diet places strong restrictions on carbohydrate intake at first, but it allows for moderate protein intake. As the person moves through the stages, the Atkins diet becomes more relaxed, allowing for more carbs and a greater variety of foods. Ketosis. The Keto and Atkins diets can both lead to a state of ketosis. However, in the Atkins diet, only the first, and sometimes second, stages involve the carb restriction required to maintain ketosis. If a person follows it strictly, the keto diet involves continuous ketosis. Long-term viability. No strong, long-term studies indicate that restrictive, low-carb diets are healthful for extended periods. In fact, the opposite may be true. Research published in The Lancet Public Health in 2018 found an increased risk of mortality among people following low-carbohydrate diets rich in animal protein and fat. The researchers also found that people following diets rich in plant sources of fat and protein had a lower risk of mortality. Many of these plant sources, such as nut butters, whole grains, and legumes, also contain carbohydrates. As a result, they are highly restricted in low-carb diets. Some people find that the Atkins diet is an achievable long-term option. Though it starts restrictive, a person introduces more foods and carbs as they get close to their goal weight. The last stage, or maintenance stage, of the Atkins diet can feel more manageable than keeping up with the perpetually restrictive keto diet. However, it is dangerous to remain in ketosis for extended periods. Also, most people are unable to maintain a very high fat intake or extreme carb restriction for a long time. Origins. Doctors developed the keto diet to help treat epilepsy in the 1920s. Researchers noted that it may have other benefits, and since the mid-1990s, the diet has become more popular. Dr. Robert Atkins developed the Atkins diet as a simple, low-carbohydrate approach to nutrition. The diet has changed over the years to take on its four-stage structure. Similarities between the keto and Atkins diets. Both the Atkins and keto diets involve carb restriction, and the effects can be similar. Weight loss. Many people follow the keto or Atkins diets for weight loss. A number of studies have shown that these diets can result in weight loss, as the body burns fat very well when it enters ketosis. Most relevant studies indicate that a low-carb diet produces more weight loss than a low-fat diet in the short term, but in the longer term, these diets produce similar weight loss results. As a small-scale study published in Diabetes and Metabolic Syndrome, Clinical Research and Reviews notes that ketosis may help manage obesity and metabolic risk factors that are precursors to type 2 diabetes. However, confirming these findings will require more research. Potential health benefits. A review published in the European Journal of Clinical Nutrition suggests that ketogenic diets protect the body from certain illnesses, such as cardiovascular disease and type 2 diabetes. These benefits may result from a reduction in highly processed, high-carb foods and excess sugar in the diet. There is emerging evidence these diets may help with other issues, such as acne and neurological disorders, although confirming this will require more research. Focus on natural foods. Both diets encourage a person to eat unprocessed foods. Highly processed foods are linked with obesity, cardiovascular disease, and other health conditions. Side effects and risks. Any diet that involves ketosis can cause adverse effects, such as keto breath, keto skin rashes, and keto flu. Staying in a state of ketosis for long periods can be harmful. Also, people following either diet can develop nutrient deficiencies due to food restrictions. For many people, carbohydrate sources are also key sources of fiber. When reducing carbohydrates, people should be sure to get enough daily fiber from other sources, such as vegetables. In addition, these diets may increase the risk of deficiencies in electrolytes and many water-soluble nutrients that come from fruits and vegetables. Finally, ketosis may help burn fat, but it may also burn muscle to use for energy. Following a very low-carb diet can result in a loss of muscle mass. Summary. There are many similarities to the Keto and Atkins diets. Both require a significant reduction in calories from carbohydrates and encourage a person to get their calories from fats. The keto diet puts greater restrictions on the source of calories. The Atkins diet starts very restrictive but becomes less so over time, allowing a person to eat a greater variety of foods. Restrictive diets may help with short-term weight loss or fitness goals, but they may not be as healthful in the long term as other options. Consult a healthcare provider before making any major dietary change. This is especially important for people with chronic health conditions, such as heart disease, diabetes, or high blood pressure. When following any diet that eliminates food groups, make sure to avoid deficiencies by meeting daily nutrient needs in other ways. Once a person reaches their target weight goals, it may be a good idea to switch to a less restrictive diet that incorporates a variety of nutrient-rich foods. Getting the right amount of daily physical activity can also help with maintaining a healthful weight.